Okay, well, it's wonderful to welcome everybody to our, um, uh, I guess, our second annual Caregiver Symposium. Um, uh, this first started 3 years ago, but then there's a little thing called COVID that got in the way. I think Joel and I have been planning his attendance at this for 2 years now. So it's wonderful for us to all meet. Hopefully next year we'll all be together, but we thought with what's going on with new variants and considering people who are immune compromised are at greater risk, that we should probably still keep this virtual nonetheless. I can't tell you how excited I am to first welcome Joel and then Austin to our community. I've known Joel uh, pretty much my whole life, except for maybe 3 years at the beginning. Joel, they're actually on this call a few past presidents. Joel himself is the past president of Brooklyn Heights Synagogue, where I grew up. Although that's not why he is part of our call, he, along with his wife, Wendy Leibowitz, are the co-founders of the ABC, Cancer ABCs, which is a non-for-profit organization that helps people thrive with cancer. Joel is someone who has had, is it 5 primary unrelated cancers, including one that metastasized and one that is a rare cancer. I don't know, Joel, if you ever decide to try playing the lottery with those that luck. Um, is that a world record? I feel
No,
like that's a world
actually,
record nobody wants.
actually, it's not a world record. When I was diagnosed, Rabbi, with my fifth cancer, I actually sent a note to what is the that World Book of World
Guinness,
Guinness, the
yeah.
Guinness, and saying, "Hey guys, you really want to talk to me because I've got 5 primary cancers," and they never replied. And then I was in a clinical trial at Memorial, and they were looking. It was a genetics. It's actually a genetics research project where they were trying to find, why my genes are so messed up and see if they can find patterns. And so I went in and I was sitting with the genetic counselor, and I said to her, the first thing is, "I bet you're really excited to see me here, huh? I mean, it's like 5 cancers, like I'm really special." And she looked at very lackadaisically at me and she says, "No, the lady that just left when you came in, she has 9."
Well, I wonder if that made you feel better or worse.
I'm not sure about that. I have to think about.
Yeah. Anyway, I can't think of any two nicer people on this planet than Joel and Wendy, who have taken the anguish or the dealing with cancer and have turned it into something unbelievably beautiful. And the amount of people that they have touched in their lifetimes through this work and just in general is not something one can measure. Um, I know that when my father was diagnosed with a glioblastoma, the first person we called was Joel to get guidance in what we do. And the guidance that we got from him was unbelievable. And I can't tell you how much it means to me to be able to share his knowledge and his background with all of you so that you all can get that as well. I don't want to talk anymore. I want to give this over to Joel so that Joel can share his wisdom with all of you.
Okay, so what I'm going to try to do, Rabbi, is share my screen and hopefully it'll work. Um,
Should be
and
set up for that now.
yeah, okay. And unfortunately, I'm having this problem again because it's showing the whole slides. I
I
want to
think if you click play from start, it should be fine.
play from start. Got it. Okay, terrific. So anyway, I want to thank you very much for inviting me to meet everybody, and um, I want to just start out with a really very brief meditation, which I put up. Where I guess in this case I'm going to read it, but if somebody wants to think about something else or think specifically about anyone else as an individual, you're certainly welcome to. Merciful God, we pray to you for the recovery of all who are facing illness and pain. We join our prayers with those who love them and grant them renewed strength and courage. Strengthen them Strengthen in them the healing powers you have placed within us all, and guide the hearts and hands of those who are entrusted with their care. Help all of us who share the anxiety of illness to be brave and hopeful. Inspire us with courage and faith. Grant your blessings to all who call upon you. Amen. And one advance. And just simply, this is kind of a brief summary of the agenda of what I want to cover. Rabbi Baisley asked me to talk about resilience, and I did briefly talk about what resilience is and why it's important when you have any sort of adverse experience in your life, including cancer. And then I also want to talk about one path that someone can take to develop resilience and kind of provide you with a lot of nitty-gritty, hands-on, roll in the grass type of things. And to be honest with you, I am actually going to be talk to you about my personal path to resilience, because I think it'll be very important and pertinent for anybody on the call. Again, as the rabbi introduced me or described, I have 5 primary cancers. I also have an autoimmune illness, and I recently have found out in the last month that I have some heart disease. So all of this requires resilience in order to go ahead and thrive and to live life fully. And I also want to say that anything I'm going to say today includes not only cancer. Everything is translatable. You can drop that word cancer and you talk about any serious chronic illness, because what I'm going to describe and discuss today really is pertinent to any chronic illness. So I think, I'm going to use that word cancer because that's what we're assigned to do today, but be flexible in your thinking. So the question is, what is resilience? Resilience allows us to function. It allows us to be happy despite experiencing setbacks, obviously including cancer. Resilience allows us not only to be okay, it allows us to continue to grow despite having these setbacks. Resilience to develop takes work, and it also takes an affirmative decision to develop it. It just doesn't happen by itself. Resilience takes time, effort, and a determination to develop it. Resilience, once you start developing it, must be nurtured. For some people, it's easier to develop than it is for others. Some struggle with it. It's a task. It's hard. Like our illness, building resilience is also a very individual and personal thing. How we develop resilience and what resilience will really end up meaning for us and how it translates into our life. But I can tell you one thing that's a universal. Developing resilience will take some blood, it will take some sweat, and it will take some tears. But it's important to do. Resilience is kind of like armor. You can still take, and you will take hits and setbacks. But with resilience, you're able to withstand and to thrive despite getting these or having these setbacks. The goal of resilience is to have these setbacks and continue to live your life despite these hits. But the real question is, basically, why is resilience important? Because if you don't develop resilience, you're going to feel overwhelmed and helpless. You're going to be depressed. You're going to feel anxious, and it can be all the time. For those of us on this call who have cancer, you probably have that experience. I know that I've had it, and I continue to have it, even though I do consider myself to be fairly resilient. The other problem with not developing resilience is that we begin to rely on unhealthy coping mechanisms. We avoid people, we avoid the issues, we avoid our family, we isolate ourselves, and sometimes we'll even turn to self-medication, and we don't get help, and that's really the problem. As we develop resilience, we will discover that we have an amazing internal resources that are available. But the big trick is not only to recognize what these resources are, but to use them. We need to learn to move forward with our life and use these resources. How you develop your own resilience will be a very individual process. We each have our own path. As we develop our resilience, we will develop both our inner strengths and marshal those external resources that we'll discover. And as I said, I hear that I am faced a number of setbacks or medical issues. And my path to resilience was very personal for myself. But I want to talk about it because I think you can use a lot of that experience. I will share with you, developing resilience was not and will not be a straight line. It won't be a smooth line. It'll be a journey that's going to be full of bumps, potholes, and pity parties. I'm an expert at pity parties. I use the process to develop my personal resilience by becoming what I refer to as an empowered patient. Being an empowered patient has built my resilience. Very briefly, when I found out that I was metastatic for prostate cancer, metastatic prostate cancer does not have a cure. And eventually, if I don't get hit by a New York City garbage truck, it's possible. I'm sorry, Barry. I will die from metastatic prostate cancer. And I was diagnosed with I had a prostate cancer reoccurrence at age 55. I'm 71 right now. I want to say that. And I became very depressed and very angry because I was 55. I had a child, I think was still in high school or maybe a little younger, and one in college. And I couldn't find anybody who looked like me. Now, I don't mean looked like me physically. I mean, who was 55 years old, was worried about getting a kid through high school, was worried about getting a kid through college, was worrying about my wife. And I figured I was going to be dead in 5 years. You read online, and that's a problem which we're going to talk about later. I would be dead in 5 years, so I'd be dead by 60. I'd have a kid in college and maybe a kid in graduate school. Probably would never see a kid get married. And I looked around all over to find somebody who had the same issues now as I do now. As I mentioned earlier, I live in Brooklyn. I live in New York City. And there are a lot of support programs available. And I went from one support group to another, looking for someone who looked like me. And I wasn't able to find somebody. And every time I went to a support program and I could find a gentleman who was 75 or 85 years old with metastatic prostate cancer, and they were worried, would they see their granddaughter married? And I was worried, would I see my kid graduate high school? I became angrier and angrier. And I went into a really, really dark place, and just became verbally abusive of the world to my family, to my friends. And I was an impossibility, and I was depressed. I was angry. I thought about doing something to myself at one point. And I went to a support group of men with prostate cancer, hoping I would find someone that looked like me. And again, I didn't. So after the group, all of my anger welled up at me. And I went to the leader of the group, and I basically lashed out to him as if he was the responsible party. Obviously, he never even met me before, and used all these four-letter words, expressed all my anger, and it was pretty nasty. Not like me, but I was. And the guy would have been somewhat appropriate if he popped up and punched me in the nose. I never believe that hitting someone is the right thing to do, but I was pushing that envelope. And instead, he sat back in his chair, pushed his chair back, and he said to me, "You're right. So why don't you do something about it?" More four-letter words rolled out of my mouth. And I stormed out of that room, went home, had dinner with my wife, Wendy, who basically, said to me, "So why don't you do something about it? He's right." Of course, I went to bed that night with smoke coming out of my ears. I couldn't breathe. I felt palpitations. And then I realized I only have 5 years left to live. Do I want to live the next 5 years feeling the way I'm feeling now? And I said, no, I can't live my life this way. So I am going to have the world's greatest pity party tonight. And when I wake up in the morning, I'm going to try to let go of this anger, and I'm going to do something about it. So I woke up that morning after I finally fell asleep, and I basically called up this gentleman who ran the group, and I said, I want to do something about it. I don't know what to do. And he sent me a task to write a blog about my experience and about metastatic prostate cancer. And that was really the beginning of my regaining control of my life. And I'm going to talk more about that and why that's important. And that allowed me to really make the next step in developing my resilience in dealing with cancer. So really, here's the problem that we have today. Too many doctors today have their nose buried in their computers, and we use electronic medical records. Those of you who have cancer and are caregivers and go to the doctors, and even those who don't have cancer, problem with electronic medical records is the doctor walks in and oftentimes will sit in their nose in the medical records and not look at us, and that's a problem. So they're not really communicating with us. Doctors increasingly are forced to work for institutions as opposed to for their own practices. So they have very stiff minimum requirements of how many patients they have to see every day, which means they don't get a chance to be like Dr. Welby was, or to be like Dr. Kildare or Dr. Doogie Howser. They don't really interact with us in the same way, in a quality way. And when a doctor moves on to the next patient, we no longer exist for that doctor. However, we go home as patients, both with the negative and with the positive results of any decisions that are made and any treatments we pursue. So, what does this mean? It means it becomes our job to understand and to make, along with our doctors, our treatment decisions. We have to remember that all treatments come with side effects, that not all treatments will work for everyone, that some treatments don't suit an individual's personality. And bottom line is, it's truly overwhelming to end up having to be responsible and make these decisions. But as I'm going to talk again, this becomes really important. So, what's the solution that I found and that I can recommend for people to think about? And that is to become an empowered patient, and that'll grow your resilience. Being an empowered patient will help you to deal with the diagnosis, get the information you need, and to make decisions that are best for you, for your body, and for your mind. Through your personal empowerment, you will become more resilient. It's no big deal to be a patient. I mean, that's not really true, because obviously being a patient means we're sick. But at some point, any and all of us will be patients. But what is important is that we become an empowered patient. It's the best way for us to deal with our serious diagnosis. Okay, if we become educated, empowered, and involved in our decision making. Empowered and patients are those who, with their medical team, will make their own health care decisions. Empowered patients have educated themselves about their disease and are really full participants, along with their doctors, in managing their medical care. We all must find a way to regain control of our lives. Being told we have a serious illness like cancer in most cases means that we're going to lose control or feel as though we've lost control of our life. Sometimes our lives will just feel like they'll spin out of control, just like what happened to me in that support group. My life just spun out of control. I was a totally new and very bad person at that time. What's important for as an empowered patient is to jointly control with our medical professionals our medical decisions that will allow us to move forward. We need to feel in control of our life. We need to build the resilience, and controlling our lives or regaining control will help us to create that armor or that resilience. And by the way, it's also going to influence our disease progression. This has been published data, information. You must learn as much as possible about your disease and its treatments. Then you can and should take personal responsibility along with your medical team in directing your own personal care. Use the internet carefully. Talk to knowledgeable people. Go to seminars and support groups. Read what you are able to. Ask friends and families for connections to other materials and other knowledgeable individuals. Most important, participate in your medical decisions, but from an educated perspective. This is your right, and it's going to improve your life and hopefully extend your life. Getting second opinions is really important, but second opinions are not just on the clinic, the doctor you see day to day. but it also includes getting second opinions on pathology reports. It includes getting second opinions on scans. These all are important as we develop treatment decisions. And we all think of a lot of these stuff, particularly, scans or pathology, as being very subjective. The reality of it is most of it is still objective and is in the eye of the reader. So we want to get a second and even a third opinion if there's an issue. I will share with you that when I was diagnosed with my rare cancer, which is appendiceal cancer, I actually had 5 second opinions or 5 opinions. By the way, my insurance company paid for each and every one of them. So we should take advantage of that and get different and second and third and fourth and fifth opinions if that's appropriate. Find out what other people have experienced. They've already been there and they've had that experience. Find a peer support group and meet others with a similar diagnosis. But as I said before, your illness is different from everyone else's, and your body and your psyche is also different. So your experience may not be the same as the other person, but knowing others' experiences can really help shape your thinking and your decision making. Remember, whatever is your decision, you may be affected by it for the rest of your life. So your decisions are really important. So take your time if your condition allows for it. Learn about your disease. Understand all of your options, as well as potential negatives and positives. I want to just digress here for a minute and talk about statistics, because a lot of times when I talk to people, they say, well, I don't want to do this treatment because it's going to have all of these side effects. And I'm only going to live for 3 months longer, because that's what, the median survival advantage might be, or 6 months. And unfortunately, a lot of times when we read clinical trial results about new drugs that are developed, we're often talking in 3 months and 6 months and 8 months statistical advantage. And people say, I don't want to go through that as those side effects. But I'm telling you that the statistics, when we're looking at statistics, are group statistics. They don't talk about an individual. They can only predict what happens to the group. So we have what's called a median. And the median is what we measure the statistical or survival advantage in. The median is not an average, by the way. A lot of people confuse it. So if you look at, a median is the middle number. So if you take the survival data that shows that men or women survive 1, 2, 3, 4, 9, 16, and 18 months on the trial. By the way, the back end in a lot of these survival statistics, there's oftentimes a very long tail on the survival advantage side. The reported median survival is just 4 months, but the average, which you have a better understanding, is actually 7.6 months. So if you take these numbers, and I just took some numbers that were simple to think about, oftentimes we're going to see that you have a 50% chance, basically, of living or having additional survival advantage that's way beyond that median number. And you just have to hope you're on the right side of the curve. So don't get concerned or confused when you only see survival advantage median numbers of 6 months or 7 months, because you could actually live 2 years or 3 years longer as a result. Statistics, I do a therapy for my prostate cancer called hormone therapy. And basically the statistics say that treatment will fail in 18 months. I've now been doing it for 18 years and it still works. So, that's something to bear in mind. I'm the lucky guy, I'm the outlier, and you never know if you're going to be the outlier. So if you don't try, you're never going to know. Again, as I said before, both you and your cancer are unique to you. Your body is different, your concerns are different, your environment is different, your family dynamics are different, and your actual illness is different than the next person's. We label cancers by the organ from which it originates, like breast cancer, prostate cancer, or ovarian cancer. But within each of these diagnostic labels, there are many different illnesses with very different genetic underlays. Therefore, we need to make sure that we go to the best possible doctor. Research is very clear, guys, by the way, women, that the more experienced a doctor is, the better the eventual outcomes. So you need to go to the expert. You need to find the specialist, that person who treats many, many, many of this particular illness or cancer. You want to go to the specialist because they will know better than someone who's treating 20 or 30 different cancers about the cutting edge, the new treatments. So you owe it to yourself to get the best. And the way you're going to get the best is by going to that person who does most of it, who is the best. Fortunately, we live in metropolitan New York area where we have a lot of options. We have a lot of great hospitals, a lot of great doctors, so we should take advantage of it. You got to remember that cancer care today is big business for the doctors and especially for the hospitals. So when you talk with a doctor, always remember that small numbers of doctors will be influenced by personal gain and not your medical condition. This is just the reality. And again, I want to emphasize it's a small number, but if you happen to be going and seeing that doctor, you're the one that's going to suffer from it. So make sure that you take advantage of all the options that are available to us. Make sure you always seek a second opinion from different doctors from different practice areas. Many doctors will, by the way, I've heard a lot of people say, well, I don't want to insult my doctor. Well, many doctors, those good doctors, will actually encourage you to get a second opinion and will ask if you've gotten one. And my personal opinion, seeing doctors on a very regular basis, the doctor who does not have enough confidence in what they suggest and direct you is not the doctor who I particularly want to have work with me on my treatment, because they don't have enough confidence in their own experience. And that's just my take on it. So get that second opinion. Make sure that you and your doctor are on the same page about your treatments, about your quality of life. You want to talk to your doctor about your quality of life. Make sure that they understand what you want from your quality. Are you more interested in length, or are you more interested in quality? Those are both very legitimate decisions that we each have to make as an individual. So you want to make sure that your doctor understands and knows what's important to you. And the only way your doctor is going to know that is by your telling them that and reminding them that. Develop a team of healthcare providers that support your role as an empowered patient. Not all docs like empowered patients because empowered patients ask questions. And so you want to make sure that your doctor is going to not only be comfortable with your asking questions and getting involved in your decision making, will actually encourage it. That's the best situation. Make sure you and your doctors have open conversations and that they listen to you and that they respond to your concerns. If not, find another doctor. Is your doctor really listening to you? That's really important. If you don't think your doctor is listening to you, say, hey, doctor, I don't think you're listening to me. Can you listen? And if that happens a few times, what do you need to do? Find another doctor. Find out how you can communicate with your doctor when you're not in a meeting with them. Will they use a telephone, email, or a portal? What is their policy on these external or extra communications? Will you communicate with your doctor? Will you communicate with a nurse or a resident? You want to make sure you're comfortable with whatever that policy is going to be. Important. Will the doctor permit you to either tape your office visit or bring along a family member and friend? And this is really important. We've been told we have cancer. We are making vital life powerful decisions, and there's a lot of emotion involved. And we don't always remember, we don't always hear what's been said. That's an experience that I have personally all the time. And that's why we need to bring somebody who's going to affirm what's been said, and we talk about it as Helga does for Barry, and as Wendy does for me, because we don't always. I know I don't always hear what's being said, and I come out and say, "Wow, isn't that interesting? Dr. Blass said this," and Wendy will say, "No, that's not what Doctor said." And as I think about it and we talk about it, she's right. But I have all this emotional stuff going on, and so it's a reasonable, that I'm going to get confused. There's a lot of information being conveyed, so you want to make sure that you can have somebody there. The other good reason to have another person at your meeting is because they will remember the questions that you go in with that you forgot to ask. It's also a good idea to kind of list out your questions before you go to your doctor's visits. But your caregiver can do a follow-up when you miss it. In other words, something is said and a question is answered, and there's a follow-up necessary, and you're on to the next question on your list. So the caregiver can really help bring you back and really explore something thoroughly. So it's important to make sure you can get somebody or at least a tape recorder at your visits. And again, is the doctor listening to your concerns? I can't emphasize how important that is. Um, Find a doctor who has extensive experience treating your particular cancer. There's a lot of evidence that the more experienced doctors have better outcomes. This means fewer side effects and better cancer control. Does doctor have the experience and knowledge about the use of off-label drugs? This only comes with experience. Does the doctor stay informed about clinical trials? And will the doctor help you identify appropriate trials when you want to go on and try something? Make sure you learn all about the possible treatment options available to you, including, when appropriate, an active surveillance or monitoring the cancer without doing treatment. Learn about surgery, including the various methods: open, laparoscopic, robotic, cryo. Learn about radiation, the different ways to deliver it, including IMRT, CyberKnife, external beam, seeds, and proton. Learn about active surveillance, as I said. Is this appropriate for you? Will you be able to deal with the side effects of any of these treatments? You want to learn about the side effects of all these treatments and these options as you go in and make a treatment decision. And really, what the most important thing is, ask questions. Ask questions. And then ask more questions. The important question to ask a potential doctor is, after I listen to your treatment plans and your recommendations, can I still choose, and will you work with me on any treatment decision that I make? You want to make sure that your doctor is with you and not against you. And it's really important. Make yourself a human to your doctor. You want to stand out in some way, so the doctor knows who you are, because the doctor sees a lot of patients every day and they're in clinic for multiple days a week. Let them know your life story. Make sure that they know that you're loved and cared for, that you're important to other people. Remind them that you have a family and that you have a place in this world. Share your personal accomplishments as you go along so they know who they're dealing with. And that's really important. And then with your insurance company, you're not going to be able to let them know who you are personally, but you should let them know that you are going to fight them if they're unwilling to support your decisions for a treatment or a clinical trial. Don't forget, you're preserving your health. You're trying to extend your life. You're trying to increase and protect the quality of your life. So this is important. So go to bat. Go to the mattresses if you have to. Do appeals. Work with your doctor and make sure they work with you on doing appeals if a treatment or a scan is denied. Check with your insurance carrier before you see a doctor and make sure that they and the treatment facilities are in network. Otherwise, you're going to get a surprise expense, which is legitimate as long as you know that you're going to get that and you feel comfortable and you're able to pay for it in order to see a particular doctor. Easiest way to do it, you can go to the web. What I like better is I pick up the phone and I call my insurance company. Could you tell me, is Dr. P in network? And they'll tell you. Make it clear to your doctor that if you have surgery, that they perform the procedure. Now, in a teaching hospital, we know that the doctor is going to be using and having residents who are learning how to do the procedure. But you want to make it very clear on your consent form that they be present and active during the procedure. You're paying for the doctor to be there through your insurance company, which means you're paying for it because you pay the insurance premiums. So you want to make sure, if you've picked a particular surgeon, that you actually have that surgeon. Medical records are really important. You need to collect all your medical records and put them in a binder, a notebook. Not all doctors can access your portal, and not all doctors have portals. I know portals are the hot thing lately, and a lot of the major hospitals, we can gain access from portals. But as I said, you can't always access it from one hospital to another, although the whole theory behind electronic records is that we can, but the reality is that we don't. So why is it important? It's important to know what's in your medical records, which means you read your portals, you get a copy of your medical records, and you make sure you understand them, because it's your medical records that talks to you about your illness. And it's your medical records that'll help you form the questions that you're going to be asking your doctor. And it's your medical records that will help inform the treatments decisions you need to make by asking the questions. And you can't ask these questions and you can't participate in making these decisions unless you understand the medical records. So you get your medical records and you read them. And yes, we're not doctors, so we're not really or shouldn't expect to really understand them. And that's why we ask questions. Doctor, what does this mean? I'm worried. I see that this particular blood test is is beyond normal. Is this something I should be concerned about? What does it mean? Does it mean I can do this treatment? Is this important? These are really, really things you need to find out. You need to read, you need to understand your questions. And again, your medical records. And again, you need to ask the questions. Remember, medical records provide the details and the specifics that illuminate the characteristics of your cancer, and you need to know them. And always remember, every question you ask deserves a full answer. And if you don't get a full answer, then you ask it again. Doctor, I don't understand. Can you please explain that to me again and use simpler language? It's your right. You're paying the doctor for their expertise, so take advantage of it. One of the first responses that most of us make when we learn that we have cancer or a serious illness is to go to the internet and speak to Dr. Google. What's really important for us as empowered patients, as resilient patients, is to be able to evaluate what we read online. When you read online, you need to trust your intuition. Don't forget, anybody can write, and everybody, anything they want, true or false, on the internet. And unfortunately, people do write a lot of false information on the internet. So we need to screen that. Stick with well-respected health websites. Learn to separate fact from opinion. Analyze any advertising that you'll see on the web page to help assess the site's credibility. Be cautious of pharmaceutical or device websites. If you're not sure who's put a website up, dig a little deeper. You'll find that the information of who puts a site up by going down to usually to the bottom of the web page and clicking on About Us or Contact Us, and this will tell you who's produced this web page. Always be suspicious of testimonials, okay? Always be suspicious of testimonials. Make sure that the information you find is the most current available. Information in cancer treatments and care changes quickly. Often you will find studies will conflict with each other. This is not to surprise you. I would rely usually on the newer will trump older in most cases. But if you're unsure and confused, that's a question you ask your doctor. Pocket card for those of us with serious illness. You can get, because something, things can happen. We can end up passing out on the street, and people won't know if we're actively receiving a treatment, which could influence what treatment would happen if we come into an emergency room in an unconscious state. So you can either go and get one of the commercial medical alerts, or even very simpler than that, make up your own card and put it in your wallet or your pocket with the information. So the information that I include on my card is my name, my address, my phone number, my spouse in health, who is my healthcare proxy, her contact information, medications with doses that I take, and supplements I take, a brief summary of my medical history that I think would be important if I come in unconscious, and most important, the names of doctors and their contacts, and also my allergies. Many people, there still remains leftover feelings of having cancer is a punishment or it's your fault. Okay? Categorically, I'm telling you, this is not true. Having a cold, having the flu, or having cancer is not a punishment. God is not looking to punish you. And it's not your fault. It's just the reality of living your life. We get colds, we get flus, and we get cancer. Live your life. Despite having cancer, don't waste it. My wife, Wendy, and I are working on my bucket list. She's been very generous and lets me work on my list over hers. I appreciate it. Thank you, Wendy. I want to see the Aurora Borealis. So what did we do? We went to Iceland. We also went with our family to Alaska. Whatever is important, do it. Don't delay. Of course, COVID has presented some obstacles but you got to figure out how to get around that. And I don't have any great advice because it depends what treatments you're on, whether you can still go out and do stuff. But I will tell you this, my goal is to do everything on my bucket list, to totally empty my bucket list. So I just have to go out and make a new bucket list to work on. So you also have to find ways to take advantage of your strengths. So you have cancer, but you are still a human being, a grandparent, a parent, a brother, a sister, and a friend. Now that you have cancer, instead you are a grandparent, a parent, a brother, a sister, and a friend with cancer. That's the only change. You're still the same person. Don't worry about yesterday. Why? Because it's already passed. You can't do anything to change it. Always practice self-care. Take care of yourself. You're a priority. Listen to your body. I had a funny, what looked like pimple on my knee. And this pimple, and again, it's like a simple pimple. This pimple kept talking to me and saying, I'm going to get you, I'm going to kill you. I wasn't hallucinating, but I really did hear this thing talk. And so what did I do? I went to a dermatologist, and when you get a skin check at a dermatologist, you put on your funny, paper gown, and usually you have your underwear on. And the doctor walks into the room, and you're sitting on the table, and the doctor will say, oh, you're here for a skin check. Very nice. They may talk to you about your medical history, see if you have any, cancer or skin cancer history or family history. And then they'll say, standard question, is there anything that is concerning to you? And I said, yes, doctor. And I pointed to just above my knee, and I had what looked like a very simple pimple. And I said, this is bothering me. It's telling me that it's a problem. And she took a cursory look and said, oh, don't worry about it. It's just a pimple. And she went on and did the rest of my skin check. And she said, you're fine. And I said, well, doctor, I'm not fine. This little mark, this little pimple is a problem, and I need for you to biopsy it. And her response to me was, I don't biopsy healthy tissue. And I said to her, this is not healthy tissue. I know that. My body is telling me it's a problem. And she said, I'm sorry, I won't biopsy it. And I said, well, here's how it's going to go, doctor. And this was at a hospital in New York City. And I said to her, either you're going to biopsy this, or you're going to have to call the New York City Police Department. And they're going to have to come and arrest me for trespass or whatever is the appropriate charge. But I'm not going to get dressed. And they're going to put handcuffs on me. And they're going to lead me out this examining room, through your waiting room, to the front door of the hospital in my paper gown and my underwear, with my behind hanging out. I said, it's your choice, doctor. And I stood there and didn't move. What did she do? She biopsied it, and I had melanoma. So you need to listen to your body, okay? It's really important. Get in touch, tune in, and listen. What would have been the worst thing that would have happened? I would have had a negative biopsy, right? That's the worst. But instead, I was able to get rid of a melanoma. You need to learn to accept your limits. What is important and what you think of yourself is important. So always stay true to yourself, including listening to your body. Seeing a situation as half full of glass of water as opposed to a half empty glass will increase your chances of making a positive action. So you need to find a way to be positive, and that'll help you take positive actions. The first step in stopping negative spiral is to realize that you're in a negative spiral. So think about it. If you find that you're spiraling down, you need to recognize that, and then readjust your thinking and your language. It takes effort. It takes forethought. It takes a conscious decision to do that. But change your language to be positive, and that'll help you get out of that negative spiral. Smile and laugh more. I can't tell you how important that is, okay? A smile and a laugh really changes your outlook and your ability to make good decisions and your perspective on life. I have to say that Cancer ABCs has a web page, and the individual page that gets the very most hits, and I'm embarrassed to tell you by what percentage, because it's extraordinary, is our page on cancer humor. Okay? That is the truth. My most popular page is cancer humor. More important than all the educational stuff we have, which I think is really good. But people want to know about a joke. And I think that's great. I encourage it. I love it. Um, Focus on your strengths. We all have strengths. We need to focus on them and not the problems and not the negatives. Once you've executed a decision, don't look back, because that, because it excuse me, once you've executed a decision, don't look back unless it will inform your next decision. Okay, it's really important not to dwell on what's happened in the past, again, unless it's going to give you information moving forward. Remember, if you follow this guide, if you take your time, if you learn about your disease, if you get involved with your doctor in making making your treatment decisions, you're going to be making the best possible decision, you and your doctor, that you could have made. So I will say what's really important. There's never room for should haves or could haves. Again, unless they'll inform the next statement. It doesn't matter. You've already done it. What's more important, what's your next decision? So I find it very hard when somebody comes to me and says, I'm so sorry that I did this treatment, and they bemoan it, but that doesn't help them move forward, and they get into a funk, and that's not productive, because what's really more important is, okay, you did it. You can't change it, right? It is what it is. But what are we going to do tomorrow that's going to make better? And that's really what's important, and that's what we all should be focusing on. Some people confuse acceptance with apathy, but there's all the difference in the world. Apathy fails to distinguish what can and cannot be helped. Acceptance makes the distinction. Apathy paralyzes the will to action. Acceptance frees it by relieving it of impossible burdens. You're your best friend. Talk to your best friend. Understand your best friend. Communicate with your best friend. Your body is always talking to you. Stop, learn from it, and listen to it. Eliminate negative people from your life. You don't need them. Okay? Find positive people. Find a way to reach out to your families and your friends. Have an honest dialogue with them. Share how you feel and what you need from them. Ask for their help. Make sure they're in agreement about being able to and willing to provide the help you need. Don't be afraid to share your feelings about how your role in the family has changed now that you've been diagnosed. Encourage your family to share their feelings and their concerns about your condition and your treatment side effects. It's really important. We all need to be honest with each other. We need to be honest with ourselves, and we need to be honest with our family and our friends. Don't be afraid to let others help you and to care for you. You're worth it. Find others who have similar experience through support groups, friends, and clergy. Get their help, and then help others who also are in situations that are similar to yours. Ask your medical team about support programs and social service programs provided by the hospital. Research foundations and nonprofits that work in your cancer area, obviously, like Cancer ABCs, or LifeGraft, which is a great organization working with people with a cancer called GIST, and then Friends of Life for breast cancer. These organizations can be very helpful. I believe that expressing your feelings, even out loud, so that you can hear them, often helps you to accept your feelings. Don't be afraid to talk to yourself. Don't be afraid to listen to yourself. Move on by making a conscious decision to live your life while you also deal with any barriers that come up. But know your limits, ask for help when you need, and do it by yourself what you're able to. But again, don't be afraid to ask for assistance. This is not a time to worry about hurting people's feelings. You want to worry about yourself. Be clear on what you need and what would work for you and what won't work. Don't be afraid to change your mind as things progress, okay? Because you've made a statement or you've asked for something, that doesn't mean you can't change. People will appreciate your honesty, and ask people to be honest back if there's a concern. If you want to share details about your health, there are a number of web places that can help you. I've listed them just briefly. Caring Bridge is a free personalized website that supports and connects loved ones during critical illness and recovery. So if you choose, you can set up a page for free on CaringBridge, and you can put data and information about your disease. This way you don't have people calling you every 10 minutes and you have 30 friends who are interested or care, and it could be overwhelming and become as much of a problem as the disease itself. So you can go to a place like CaringBridge and you can post regularly. They can pose questions. Care Pages is also a free page where you can put up a blog, so you can tell people about what's going on, and that way it relieves some of the pressure. Bloggers also has free blogging tools and templates. Facebook is a possibility, but I caution, if you use Facebook, it's got a great reach, but everybody in the universe can read about your medical condition. The other pages I mentioned are private because they give you password protector. Again, same with Twitter. And Lots of Helping Hands is another possibility where they help assist individuals and anyone needing support due to illness and infirmity, military needs, or rather financial needs. So you don't need to have to field 10,000 questions every day. You can just put it out in one place, and it relieves a lot of pressure. Exercise is really important. It's vital, guys. It has a significant effect on your mental health, also your physical health, and your ability to deal with the possible treatment side effects. So you want to make sure you do that. It's very clear that our environment does influence our health and our well-being. Living with stress will not only influence the quality of a life, it can actually kill you. I had a gentleman who was a stockbroker, lived in a very high pressure area. He came to me and he had metastatic prostate cancer, was very ill, and he decided to retire. And in the course of about 3 or 4 months, as he eliminated all that stress, the treatment started working. He got better. He was feeling well. Matter of fact, he was feeling almost too well because he decided to go back to work. 6 months later, he died. I personally am convinced that stress and the effect of his cancer killed him. I don't have any evidence, but I truly believe that. You need to find a way to eliminate stress. It'll make it go a long way. By the way, there's no shame in getting help to deal with your life and your diagnosis. Well-trained therapists and proper medications, if needed, will enhance your well-being and the well-being of your entire family. The American Psychological Oncology Society provides a free referral line for psychologists who specialize in treating people with cancer. This is just one possible referral line. Ask your doctor for help in locating integrative medicine programs, programs at the hospital. You want to take advantage of what's available. There are a lot of opportunities. And by the way, I want to say being depressed, being anxious, does not mean you're crazy, and going to see a therapist does not mean you're crazy. It just means you're a human being who has cancer. Clinical trials offer cutting-edge treatments many years before the therapy will become available. That's really important. A lot of us think of clinical trials as being something to experiment, to develop new treatments. But oftentimes you need to consider it as giving you access to a cutting-edge new potential treatment, it's still in trial, that you may not have access to for 5 or 6 or 8 or even 10 years later as it goes through the clinical trial process. I see Barry shaking his head yes. I can just call him out. Barry mentioned earlier that he's on a clinical trial and has had remarkable results. I couldn't get that treatment because it's not approved yet by the FDA. But Barry will tell you that he's here today with his feet on the ground because of that trial. Understand about, I hope you don't mind me calling you out, Barry. Understand about clinical trial phases when you decide what makes treatment. Phase 1 is first in human, and its deal is solely to find the maximum dose before we reach toxicity. Phase 2 confirms the proper doses, and it begins to evaluate if there's any benefit. And then phase 3 is comparing treatments to the standard of care to see if there's a difference. As you're thinking about a trial, confirm who may pay for any extra medical assistance that you may need. Will it be your responsibility? Will the trial be paying for it? Or will your insurance company pay for it? And the only way you know that is by speaking to the trial nurse or the PI, the investigator, and your insurance company. Always remember that trials are very heavily monitored, and so if there's problems, they're going to get stopped. read the consent agreement. Okay, you're going to be given an agreement that's going to explain to you what the trial is, what the risks of the trials are, and they need to be fully explained. This is your opportunity to understand the trial. It's your opportunity to ask questions. Ask questions. If you're not sure you understand the significance, ask questions. Take the consent or agreement back to your own doctor and ask them to go over it. What do they think about it? Is this something that makes sense for you? Hopefully, you've already involved your doctor in the decision to do this trial. Know what phase the trial is and make sure you're comfortable with it. And always remember, you can always withdraw from a trial at any time. It's your right, and you do not have to explain why you've chosen to withdraw. You just withdraw, and that's the end of it. So, being in a clinical trial is not a long-term commitment unless you want it to be. Being diagnosed is a good thing. That's a weird statement, I think. Hey guys, being diagnosed with cancer is a good thing. Why do I say that? Because now that you've been diagnosed, you're able to start treatment and become an empowered patient and move on. So, yeah, it stinks being diagnosed, but on the other hand, it's better to be diagnosed if you have this disease than not being diagnosed. Okay? Being an empowered patient will help you to extend your life. Getting treatment will extend your life, and hopefully being an empowered patient will preserve its quality. Just some guidelines. Believe in the strength of your prayers. Believe in the strength of your faith. Believe in miracles, because they do happen. 18 years on a treatment, guys, that shouldn't work after 18 months. That to me is a miracle. Believe in yourself. Have confidence. A quick note to our caregivers. First of all, I thank you. I thank you. I thank you on behalf of all cancer thrivers. Okay, I happen to think that your job is probably the hardest job. I think being a caregiver of a cancer patient is much more difficult than being a cancer patient. I really believe that. Um, okay, but you have to do things to protect yourself. Practice self-care. Okay, make sure you're always thinking about yourself in the process, because if you get sick, you're not going to be available to help the patient. So self-care is important. Find a way to share the caregiving burden with other individuals, with friends, and with families. You don't need to do it by yourself. Take some time off. Become an empowered caregiver. How do you do that? You have to be really honest, just like the cancer patient, about their feelings. Do the same things we talked about. Talk out loud about your feelings. Learn about yourself. If you need help, ask for help. Take a break. Go on a vacation. You can leave the cancer patient, with somebody else for a couple of days. You need to preserve your own self, your own sanity, your own psyche, and your own health. Never feel guilty about being unwilling or unable to perform a specific task that you've been asked. Find a caregiver support group or family support group or program. They exist. They even exist for young children, because young children often don't understand if a parent is ill, and they also get cancer themselves. So reach out no matter who and what you are. Never lose hope, guys. Okay, this is really important. The history of the last 10 years has clearly demonstrated that we are constantly improving, and we're constantly adding treatments that extend our life and protect the quality of our life. Our common goal is to stay alive long enough to welcome the next new treatment. Given the large numbers of investigational treatments under development, the concept of turning cancer into a chronic illness is realistic, and hopefully many of us will see that. I just point to President Biden's cancer initiatives. They're a great example why these options are improving. Never lose hope. When I was first diagnosed with metastatic prostate cancer, there was hormone therapy, chemotherapy, one type of chemotherapy, and some treatments, pharmaceutical treatments that really didn't do anything but make you sick. Today, the options are maybe 15 or 20 different treatments, and that's over the last 15 or so years. Things are changing. Don't lose hope. Just to leave behind, becoming an empowered patient isn't easy. There are pitfalls, confusions, discrepancies throughout our journey. Our job is to sort out the noise, the mistakes, and the misnomer. I think this was T.S. Eliot that said it. There's been some questions, so if somebody who can tell me it wasn't T.S. Eliot and who said it, I would appreciate it, but I think it was. And then one of my mentors, is late Barry Bart Kamen, who said, we need to figure out what is the correct for ourselves and what is our own personal wisdom. It's our job to sort out the knowledge from the facts, and most importantly, the wisdom from the knowledge. This is my email address if anybody has any questions, and our webpage. I'm always glad to respond to emails and even phone calls. And if you can't write this down, Rabbi Baisley can reconnect us. This is Misha Bera, and I will just say I wish everybody health and happiness. And I think that's the end of my presentation.
Thank you so much.
Thank you, Joel. I think you need to stop the screen share. Oh,
Yeah, I'm
I'll do
trying to do that. Yeah, okay, thank you.
I want to open us up now to any questions that you might have. You can either type them into the chat or raise your hand or unmute yourself. I can tell you from talking to some of the congregants on the call right now that I hope they heard some of the things you said about resilience, about making sure you smile, about advocating for yourself, because you spoke to a lot of people and what they were wrestling with right now, either through a course of multi-year cancer care or just at the beginning of it right now with uncertainty laying open ahead of them.
Just talk.
Oh, yeah.
Hi. Can you hear me?
Yes.
Hi, Joel. That was great.
Beautiful.
Joel, it was great. I do have a question. At the very beginning of your presentation, you talked about getting second, third, fourth opinions. Doesn't that sometimes confuse your brain when you're dealing with cancer and then you're getting all of these opinions coming into you?
Yes. That's an excellent question. I mentioned the rare cancer and I had 5 opinions, and I will tell you I had 5 different opinions. And yes, it was very confusing. Basically I had opinions that ranged from basically doing almost nothing to doing this surgery, which basically involved opening up my peritoneal sac and taking out every organ in my peritoneal sac and scraping it because of the nature of the cancer. And this was a surgery that normally, without a complication, and when that was somebody who's had multiple prior surgeries, doesn't have scar tissue, takes 12 to 14 hours. So that was the range of recommendations. And it was hard. It was difficult to make a decision. Obviously, I chose not to do either side because I didn't think I would live, ever get off that table if I did that radical surgery. So it just, yes, it was hard. It was confusing. And I actually did something kind of midway. And I'm not recommending that midway is the answer for everything, but in this case, that's what I did. I did surgery and chemo. It can be confusing, but on the other hand, it could also add a lot of clarity. So if you get a second and a third opinion that are pretty consistent, then you're going to be more comfortable and more confident in moving in that direction. So I think it can be helpful, but yeah, it's not always easy. So with men with prostate cancer, and we talked about pathology being, being subjective. We have if you do a biopsy, they develop what's called the Gleason score, and a Gleason score is a score that will look at the tissue and basically judge its aggressiveness, and that'll theoretically will help you make a treatment decision. And one of the first things I say to someone with prostate cancer who just has their biopsy results back and they're making a decision, I say, well, let's make sure that your Gleason score is correct, because that can change your treatment direction. And I have two resources on our webpage that will actually give second opinions on prostate cancer biopsies. And it's two of what I think of the experts. They do more of these pathology reports than anybody else in the universe. And I'm going to guess that 25 to 35% of the times, the Gleason score comes back different from second reading. Now, what do you do in that situation? Well, you have a couple of options. You can either decide to go with the person you have more confidence in, who has more experience, or get a third reading and see if there's some consistency there. That doesn't guarantee it's going to be right, but it'll improve your batting average, so to speak. So the answer is, yeah, it does. It can add confusion, but you may end up with a better decision. And worst case, if you take a second opinion and that's would have been the better direction, and you go with the first, you're doing the same thing you would have done anyway without the second opinion. I don't know if that makes sense. So
No,
yes,
that actually was a great explanation, because I was, thinking five different opinions, 5 different answers, and you're like, okay, let me throw a dart at this.
well, I mean, I have to say there was a little dart throwing because I had to figure out, as I talked about, you have to decide what it is that you're comfortable with. So I knew coming out of the starting gate that I wasn't comfortable with the most radical treatment, because I also believe that I wouldn't be here today if I hadn't. I truly believe that. I would not have come off that table.
Right.
And I also knew that I was giving a statistic, and I, what I think of statistics, they got limited value. The value is to the group, not to me as an individual. I was giving a statistic that if I didn't do anything and just watched it, that there was a 40% chance that, or even maybe 50, I don't recall now, that I wouldn't have to do anything going forward. Personally, again, here's where your own personal self gets interjected into your decisions, and knowing yourself, knowing who you are, and figuring that out. I personally couldn't tolerate a 40% risk of having a problem that I didn't deal with. It just wasn't me. I'm not a gambling person. You're never going to find me playing, at a casino because I always lose. And so I hate it. And to me, it was the same thing. So I knew I had to do something. I just knew what I wouldn't do as far as treatment. So I kind of fell in the middle. So how you make these decisions are going to depend upon who you are as a person and what you're comfortable with also. I think that's important. You got to factor in your personal stuff and your personal attitudes and your personal beliefs.
That's great. I have another one. What's ASCO?
Oh, I'm sorry. Wendy said I shouldn't say should say ASCO. It's the American Society of Clinical Oncologists. It's the largest clinical oncologist professional organization. They have great website. NIH is a great place. The federal government websites. But ASCO is the American Society of Clinical Oncologists. And they all the researchers know about it. They go to the conference. And this is where we learn about, we make a lot of the progress when these abstracts and presentations are delivered, but they have great patient web resources also.
Great, thank you.
I want to add to something you've been talking about, and you mentioned intuition. I think intuition is profoundly important. If you're smart and you get diagnosed with something like this, you're going to do your early research. Now, in my particular case, I did not go to the internet. I did not go to the computer. I asked strangers on the street, hey, you know anyone who had prostate cancer? And as it turns out, I wound up having 10, 15 people that I talked with that had already been through all this and had different paths and so on and so forth. And that led me to find where I wanted to go in terms of medical professionals and so on and so forth. And that worked out really well. I think avoiding the internet was a blessing for me, because you can read and then you can run away with it. And that's just going to destroy your psyche and so on and so forth. With regard to resilience and having humor, this is what I do when I go in to see my oncologists. And the one word instead of resilience that I use is fortitude. And fortitude is mental and emotional strength in facing difficulty, adversity, danger, and temptation. I think I've always had it through the whole of my life, but this was different. This was profoundly different. This was life and death. And after I had my surgery and met with my surgeon post-surgery, 3 months later, I figured I'm just going to go home. He says, sorry, I can't go home. I have to pass you off to an oncologist. And that's when I was blessed to meet my first and best oncologist that I've met to date, who recently left practice and went into research in terms of clinical trial, in terms of research and treatments and the development of treatments and so on and so forth. But I became an advocate real quick, and I learned that through caretaking from my mom and dad. So that, for example, as Joel mentioned, question everything. And boy, do I question everything. When I went in to see Dr. Bilar, who had great credentials, I would come in with 4 or 5 typewritten pages of questions. And I did that for 2 or 3 years until at some point I gained his, I had his respect and knew with whom I was dealing. And I said to him one day, no more homework assignments. Unless it's something really vitally important, you're my guru. You're going to tell me what I need to know. If something came across my path through my elder brother or somebody else, and I thought it was vital, then I would ask him. And he would give me as much time as I needed, which is, again, was something that Joel alluded to it at some point then. But when it came to certain tests that needed to be done, scans, my insurance company turned me down. Not me. I did what's called independent medical reviews. And I fought the insurance company via independent doctors that had oversight. And every single time I fought, I won. Because I came to learn that the primary generic bone scan is called Taxesium 99M. I'm making up the number. I don't know the exact number, but that was roughly $1,500 of cost to the insurance company. At the time, the sodium fluoride PET scan that they wanted to have, which they told me was more detailed, we're going back 5 years now, so things have changed since then. But I was told that this would be a better scan, and I fought, and I found out that that scan cost the insurance company $7,500. So the insurance company's decision was solely about, money, and I wasn't going to let that rule my life, and their decisions rule my life. And I won twice, and to the point after the second time, I spoke with somebody higher up the food chain in Aetna, the insurance company, and they put it on the permanent record. Barry no longer has to fight for that, scan. Unfortunately, or fortunately, I've never needed it again. But in terms of trials, I was fortunate that I asked a lot of questions, and I jogged the mind of my oncologist. They're humans, they don't know everything. They don't remember every little thing that they need to know. So if you ask questions, you never know what that's going to affect that on them. And as it turns out, one of my questions led to my participation in a clinical trial. And I was lucky that, I didn't play lottery, but I played the lottery with whether I was going to get an experimental drug or a placebo. And I got the experimental drug. And April 7th, I think it is, will be 5-year anniversary. I am in my first treatment, and it's been working beautifully for 5 years now.
Nice.
So humor, asking questions, and never give up. There's a thing to hear that says never give in. I was given that 5 years ago when I went to a symposium at something called the Omega Institute in Rhinebeck, New York. And it was for all kinds of cancers. And it was a wonderful 3-day, beautiful exhibit. And at the end, a bunch of us that were there specifically for prostate cancer got together, and there was one gentleman that handed these out. And I now have a stack of these that I hand out. Never give in. It's a reminder every single day. There's more, but I think I've shared, and it's taken enough of your time. And Joel, I'm blessed to have met you.
That's a great presentation.
5 years ago or 6 years ago when we met that first one, we used to meet in person. And I'll forever be grateful.
Thank you so much, Barry. I just typed into the chat that if anybody has any questions that they'd prefer not asking publicly, that you can also send it to me in a private chat and I'll ask it for you. But again, you can unmute yourself and ask. I know it's hard sometimes to get a conversation going on Zoom like this.
Rabbi, I'd just like to make a comment to something Barry said or clarification on clinical trials. He said he was fortunate in getting the investigational treatment as opposed to the placebo. It's rare. I just want to clarify for people because this is a real concern. People say, why would I want to participate in a clinical trial if I may get a sugar pill? For the most part, in most cases, I can't say 100%, we don't use sugar pills. We don't use placebos. We use what's called the standard of care. So you're never going to be denied what is the standard of care. So you're either going to get the standard of care, what you would have gotten if you were not going to be in the trial, or possibly the investigational treatment. I just want to clarify that sugar pills almost never have a role in clinical trials today. So don't let that be a barrier or a concern.
That's good to
Thank you
know.
for that clarification. That was important. Thank you.
Well, Joel, I can't thank you enough for your presentation. I know for some of us that was a lot of data, which is why we recorded it and we can share all of it so you can go back and look at the video and find those links and find those web addresses. Again, you can go to cancerabcs.org for all of these resources, and the jokes are pretty good too.
Rabbi, could you share where we could access the recording of this meeting?
We're going to send it out to our congregation and probably put it also on our YouTube
Joel, would
channel
you
as well.
if you get that,
Yeah.
Joel? Could you
I will
share it?
I will get it from the synagogue and either post it if it's okay with the rabbi on our webpage. Is that okay?
Absolutely. And we have a YouTube channel as well. If you go to Anshe Emeth Memorial Temple on YouTube, and we'll post it there as well, and you'll be able to see it. So,
I'm sorry. Could you? I wrote down and copied all the details from the email I got, the invitation, and I don't see a reference to the synagogue at all, unless I'm just blind.
I apologize. I sent Rabbi. I had sent an email out to a number of people on my email list,
sure.
and since I think I wasn't clear. I thought that this was done with the New Jersey Interfaith Cancer, so I have their name on it. I didn't realize how that interplayed, so I apologize.
No worries.
So that was not on the email I sent out. What was the New Jersey Interfaith Cancer Care.
Joel, you have two assignments. A link to the recording and the name of the temple would be
You
wonderful.
got it. Absolutely. It's, by the way, I love that temple. I just want to say I've been there a few times, and it's really, I just wish they were closer to me physically, because this rabbi is amazing. But the answer is I will be glad to share their link.
Thank you. And I'll pop the link to our YouTube channel into the chat in just a moment. But speaking of the New Jersey Interfaith Cancer Center for Cancer Care, or NJIC3, it is a pleasure to welcome Austin here. He is the, hold on one second while I add spotlights. There's only so many things I can do at once. Austin is the Community Engagement Coordinator of NCIC3, the New Jersey Interfaith Center for Cancer Care. I first got to know the center when they brought some teen interns into the program who wanted to learn more about Judaism and our response to cancer and illness and why do things happen to us like this. I want to turn it over to you, Austin. Austin is a phenomenal individual who does such great work in the community, not just with NJIC3, but with Reformed Church in Highland Park. Austin, it's a pleasure to welcome you here today.
Thank you very much, Rabbi Baisley, and thank you for everybody joining. And I am now going to attempt to share my screen with the caveat that you'd think after 2 years of doing this, I would have some confidence in my Zoom abilities, but I don't. So hopefully this will go smoothly. One moment.
There you go.
Okay, so far so good. Again, my name is Austin, and I work for a very small nonprofit organization called NJIC3, the New Jersey Interfaith Center for Cancer Care. Before I tell you a little bit about the organization, just want to tell you a little bit about my personal journey and what brought me to my job at NJIC3. In 2000, I guess it was 2009, I was living down in Atlanta and was having some unusual medical issues. However, even though I was working full time, I was uninsured because I worked for a very small business and they did not provide health insurance, and getting a policy on my own was out of the question. So I did the best I could to try to figure out what was going on, but never really got any definitive answers until I found myself in the ER of a hospital in Atlanta called Grady Hospital. And in Atlanta at the time, Grady was not a hospital you wanted to go to. It was not known that, it was known to be the place where you went if you were indigent. But that is where I ended up. And in hindsight, I couldn't have ended up at a better place. It also ends up being a teaching hospital for Emory University, which definitely was to my advantage to have the resources there. But through that hospitalization and some follow-up care, I was diagnosed with a somewhat rare blood disorder called aplastic anemia. The treatment for which required me to go to plan to be in the hospital for about 2 months and receive the equivalent of a chemotherapy treatment, but I was going to be receiving some, I think it was horse amino acids or horse enzymes, because my blood cells were eating each other. My platelet count at the time was 14,000. It should be somewhere between 140 to 400,000. And it was not going to be an easy treatment, but obviously a necessary one. Well, the night I checked into the hospital, a med student had popped in and was talking to me about what to expect from the aplastic anemia treatment, only to accidentally tell me that while I'm there, I should really talk to my doctor, because he saw the results of a test I had, and he saw that the biopsy had come back, for a cancerous tumor. And I think that it was probably very clear to this med student by the look of shock on my face that I had absolutely no idea that this cancer diagnosis existed. He quickly grabbed his pens and papers and clipboards and made a beeline out of the room. So I was just then left to sit in my room by myself, trying to process the fact that I thought I was coming in for one treatment. I had just been told about a cancer diagnosis. And then I get online, of course, as we do, and I quickly found out that having aplastic anemia and having cancer, the treatments for each respective disease exacerbate the effects of the other disease. Shortly thereafter, my doctor came in, and I told her that, oh, someone had spilled the beans. The treatment for the aplastic anemia was scrapped. Instead, the focus went on to the cancer. I probably spent the next 3 days getting infusions of red blood cells. Then they pumped me full of platelets. I had surgery, came back with a stage 3C staging. And then I just sat in the hospital for a while because nobody knew what to do with someone who had aplastic anemia and cancer, because again, the treatments really exacerbated the other. And I distinctly remember the night the chemotherapy oncologist and her colleague came in and said, there's no way you're going to be able to withstand chemotherapy and radiation. She said, that combination will kill you with your aplastic anemia. If you choose to only take chemotherapy, you'll have a longer length of life, but your quality of life will be diminished. If you choose radiation, you'll have a shorter length of life, but you'll have a better quality of life because you won't be dealing with the side effects of chemotherapy. And I'll be back at 8 o'clock tomorrow morning for your answer. And then she and her colleague walked out. And from that point on, I referred to them as the angels of death. I met with my hematologist very quickly and decided to just go forth with radiation. And I did not want those doctors to ever get near me and mention chemotherapy to me again, based upon their presentation. I was lucky enough to be partnered with a wonderful radiation oncologist who had to be very creative because the type of cancer I had, the typical radiation treatment would focus on my pelvic bone, which I really needed my pelvic bone to be in as good shape as I could, since it is a factory of blood cells. So he had to devise a completely unorthodox radiation treatment, which he said, here it is, let's give it a shot. Never done this before, but if you're willing to try it, I'm willing to do it. So I went through radiation and then ended up moving to New Jersey in the late summer of 2010, about 2 months after completing radiation. And everything went smoothly thereafter, or so I thought. And then in 2015, I thought I had what was just a skin tag on my eyelid. After going to a dermatologist, they said, we're not going to touch you. You need to go to an ophthalmologist to get that removed. Ophthalmologist removed it. The biopsy made its way to the Mayo Clinic, where they diagnosed me with a relatively rare form of cancer. Luckily, at that point, I had insurance, and I ended up at the Wills Eye Hospital to have surgery over there. However, given the combination of the two types of cancers that I had, plus my dermatological condition I have, combined with the history of cancer in my mother's side of the family and the type of cancers she had and the type of cancer in her family, my doctor told me there's a very good likelihood that you have a condition called Muir-Torre syndrome, which makes you at a much higher likelihood of developing certain types of cancers, two of which I've already had, than the average Joe. The only way to be 100% certain would be for you to get genetic testing, which insurance was not going to cover. But she said, I think it's a pretty safe bet that we should just move forward, under the assumption that you do have Muir-Torre syndrome. So I have to have colonoscopies and upper endoscopies a little bit more often than everybody else, some of which have had to be navigated through periods of time when I was once again uninsured. And I just say all that because that journey is really what brought me to work at NJIC3. NJIC3 is my part-time job. I work full-time for an organization that helps individuals who've been in prison or jail reconnect to the community. But when it was possible for me to work for NJIC3, I leapt at it. NJIC3 we support anybody who has cancer, but our primary focus is working and trying to help the uninsured and people from marginalized and disenfranchised communities. And as I had to navigate and deal with my initial cancer diagnosis uninsured, that really spoke to me. And I said, if I can help people, based upon my experience, I would definitely like to. So NJIC3, we are a very small nonprofit program. We're based out of the Reformed Church of Highland Park. They let us have office space there. And we were founded right before the pandemic, after one of the church members passed away from pancreatic cancer. And his dream had always been to establish an interfaith organization that would support people in their cancer journeys. And we operate on, the founder of the organization, Pastor Seth Copperdale, refers to these as the 3 pillars of our mission: care, collaboration, and contemplation. So for the direct care, again, I mentioned our primary focus is communities that don't have the best access to medical care. We focus really on providing emotional, practical, and spiritual support. And that's not to say that myself and the core group that I work with have all the answers and can provide all of these things ourselves, but we help connect our the people we work with and support to different resources in the area, whether it's connecting them to mental health care, whether it's connecting them to the cancer navigators at the Rutgers Cancer Institute of New Jersey, whether it's connecting them to various houses of worship for support. We can kind of build those bridges and help them reach out if they need assistance. And then for collaboration, we're very involved in advocacy. A couple of weeks ago, we met with Senator Degnan, as well as Assemblyman Kermachek, whose name I'm sure I butchered, and Assemblyman Sterling, to talk about 3 important policies that are have been introduced affecting healthcare, specifically around cancer. And then Senator Degnan, he at the beginning of March actually introduced a bill that NJIC3 brought to him. It's a bill that, if passed, would provide for the Department of Health to fund community screenings, working with community-based organizations and faith-based organizations, providing $100,000 for those organizations to launch screenings in communities that are underserved. So we're very involved in advocacy, also involved in just creating awareness among communities about the importance of cancer screenings and how to try to access them, as well as in educating people about different types of cancer and the different cancer screenings that are out there. And then contemplation, we do work, excuse me, with different houses of worship, and we lead a interfaith prayer meeting every Friday. We have a book group, an interfaith book group that's temporarily on hold. There's also, excuse me, other contemplative opportunities, whether it's discussion panels, whether it's one-on-one meetings. However much someone's spiritual life or faith life comes into their walk with cancer, we want to support them as much as we can. And then we're also, I hit the next too early, but we also work and collaborate with different organizations. For instance, one of the organizations we partner with is the Visual Arts Center of New Jersey. We currently have a art series launched on Facebook and on Instagram called Cancer in the Creative Spirit, highlighting artists in New Jersey as well as outside of New Jersey whose lives have been impacted by cancer. And by artists, that means anywhere from professional artists to people who just picked up a paintbrush one day and decided they wanted to have some, have a little bit of a creative outlet. We're also going to be launching in May an interfaith discussion series called From Birth to Death, How Different Faith Communities Commemorate Life's Milestones, where we'll have representatives from different faiths and religions and denominations discussing how different communities approach different life events that everybody encounters, and looking at the similarities and the differences. And one thing that my former coworker Liesel and I used to spend a lot of talking about when it came to talking about the differences and similarities of religions and approaching life events, as well as approaching a cancer diagnosis, is how do you provide support to someone along their cancer journey when their spiritual beliefs differ from yours? I am someone who is a fixer. If I am, as my wife will attest, I want to take immediate action and just fix whatever the problem is. However, as we are an interfaith cancer center, we are here to support people in their different beliefs and different faiths, and to validate their beliefs and their personal theologies, even if it differs greatly from what I believe or what one of our volunteers believes. And that can be a difficult road to navigate. Just a couple of examples are, for instance, say, the person, myself or one of our volunteers is talking to, is starting to sink into a depression because they believe their cancer diagnosis is a sign from their God that they failed to live a righteous life. Even though that's not what I believe, it's what this person that I'm providing support believes. So how does one kind of squash their feelings and support the person they're talking with, knowing that this is their theology? Another example that we've encountered is, say the person that we're supporting has decided not to begin their radiation treatment, or say they've decided not to take medications because they believe the only way they can be healed is through the power of prayer. And their doctor has advised them of the short life expectancy of someone who doesn't undergo radiation. Of course, my knee-jerk reaction is to say, what are you doing? But I can't say that because, again, their belief, their faith, their spirituality is dictating this decision. So how does one provide support while still acknowledging that their beliefs are valid? And another example is that, say you're working with someone who believes that their cancer diagnosis is a test from their higher power, and they're struggling to wrap their head around how God could put them through such a grueling test, a grueling ordeal. And they're beginning to lose their faith because of this test, and that's causing them to pull away from their spiritual community, which has been their main source of support emotionally and practically during their illness. So again, it's not my spot, it's not my position or one of our volunteers' position to tell them that their theology, that their religion, is wrong, that this is not a test from God, because it's what they truly believe. So again, how does one acknowledge their beliefs, but still try to guide them in a way that might have the best possible, outcomes for all? And those kind of situations are really the crux of the difficulties for the one-on-one care that we support. There are organizations, and there's the great cancer navigator system at the Cancer Institute that can really help with the practical matters. But it's dealing with each of the people one-on-one when their faith and their beliefs does come from such a different part or a different place than what we may believe. That really proves to be the most challenging, and at the same time, I think affords the most opportunity for growth. And so I was wondering if anybody might be interested in sharing any of their thoughts on how if they've experienced a situation like this before, where someone they've known who's had cancer or has cancer is coming from such a different philosophy than they are, and you've had to kind of put your beliefs aside to support their beliefs and and make them feel heard and validated. or if anybody has really thought about any of these, these types of questions. And because that's really one of the, like I said, one of the things the NJIC3 is here to do, is to really provide care from an interfaith perspective, not to say that one is correct and the other is wrong, but do our best to make everybody feel that they're heard and seen while trying to connect them to the best care possible. I know Dr. Poplin, Beth was at an adult ed class we led a couple of weeks ago, and participated in an exercise that we did that centered around this. And I don't know if she would like to talk for a moment about what that experience was like, about having to really consider other religions and other faith in providing support, or like I said, if anybody just has any experience or any thoughts on what that might feel like for them.
Am I on? Yes.
Yes.
Yes, you are.
So I come from the perspective of a past medical oncologist and current palliative care person. And the similarities in the jobs is that I end up listening to a lot of people. And I think that's the key. That's the key. Okay. You can't be that person. You can empathize with the person, but the only way you can empathize is to listen. And maybe walk with them as they try to discover what the implications of what they're doing mean to them, and then maybe shove them a little bit this way or that, very gently, but mostly just listen and let them come to where they need to be.
Which can be a hard thing to do, right? Especially, I think when it comes to, for instance, the example of the person who had said that I'm just going to put it all in God's hands, I'm stepping away from my medical treatment. When you hear someone say that, and that from a scientific perspective, that the radiation or chemo or whatever the case may be could make such a difference. I think it is hard to develop that ability to listen and not sometimes just jump into the solve it and fix it mode.
But you can also say, so what makes you think that he's told you that?
Mm-hmm.
Tell me more. And then just keep the conversation going.
Mm-hmm.
I love that the listening. Thank you, Beth. Actually, I have a story I want to share that's kind of in regards to that. And I think what I'm going to do is remove all the spotlights so that we can all see one another. I have 2 years of doing this. I still haven't gotten used to coordinating this while doing this all at the same time. If you put yourself in gallery mode, we can see one another. When I was in seminary, I was a chaplain intern at NYU's Langone Medical Institute with healthcare chaplaincy. And with me, there was another intern who was from one of the Christian faith traditions that really heavily believed in the power of prayer and perseverance, and that all of these ailments came from God as a test, and that the key to surviving it was through prayer and perseverance, and that if you succumb to it, you're not persevering enough and you're not having enough faith. Which is fine if that's your own personal belief, but a little different if you're saying it to other people. And he would come into a room and he was telling stories about this. There was something called verbatims and group conversations where we would share stories of what happened in the room so that we could break it down with one another. And usually the stories that we would tell had to deal with our own baggage rather than what actually happened. It was more for understanding and unpacking how we were feeling and our empathy versus sympathy, and kind of going through that emotional processing of how can we be present in the room. Because I'm sure, you know, Dr. Poplin was in the room with us with my father in his final hours, and was I can't tell you the amount of comfort that she gave my mother at the time, by just hearing us and holding our hands and being with us. And that's not an easy thing to do over and over and over again. And it's hard for you to be there for another if you're having, you know, your own stories come up and your own narratives come up. Anyway, he presented to the group that somebody was dealing with stage 2 cancer, and was dismayed at it going from one stage to another, or the concern that it might have metastasized, and this chaplain intern gave the response that it went to stage 3, or if it did metastasize, it had to do with you're not giving yourself up to Jesus, and that only you were to blame because of not having enough faith. And when he presented that to the group, and by the way, this is not something that I think is strictly a Christian theology, but it's found in Judaism and Islam and other denominations as well. The issue is not the theology, but that he said this to the patient. I can't tell you how quickly that room got dead silent, and we all kind of stared at one another before the supervisor said, "Please excuse me for a moment," left the room with the other supervisors, came back, and that intern was no longer an intern the very next minute. And there were some ethics charges and whatnot. But yeah, the thrusting theology upon people, especially in terms of cancer, can be a very dangerous thing. And the power of just listening is unbelievably important. Other thoughts out there?
If I can add, excuse me, just a note to that. As Rabbi Baisley knows, I'm not a theological person.
To say the
We
least.
won't go down that road right now. But I am a psychologist, and I very much what Elizabeth said and what Rabbi Baisley said does resonate with me. Obviously, there are no easy answers to that. And you certainly don't want to tell the person A, B, and C. You'll pardon the phrase today. But listening is the best thing, and try to pick out from what the person is saying what seems to be helpful to that particular person, and go there without trying to delve specifically into theological beliefs. You know, as Rabbi Baisley said, it's not unique to Christianity. Blaming the victim is something that a lot of not only religions, but a lot of philosophies do. And so I would try and find out from the person himself or herself what it is that is helpful to him or to her, and then try and help that person to move on with that. And what's particularly useful, I found, is that when the person himself or herself is engaged in that process, then it becomes more useful to that person. And not only in the brief session you might have with the person, but ongoing throughout the person's daily existence, maybe that person will begin to think about those things.
Nice.
I wanted to share one piece of advice I got from somebody. Early on, I mentioned that I didn't go online when I was first diagnosed. And I asked strangers or people in my family and friends and so on and so forth if they knew anyone who was dealing with my particular cancer and intensity and so on and so forth. And one of the persons I met was a friend of a childhood friend. His name was John. And John, unfortunately, was dealing with my situation at a much younger age in his case. And he became a very, very active mentor to a lot of people. And he became a mentor to me of great advice. And the one thing he taught me as I started to become a mentor to other people, I mean, I'm 5, 6 years into it now. So friends, family, neighbors know what I'm dealing with. And they ask me if I would be willing to talk to people they know. And the one thing that I heard from John over and over again was listen carefully, which is what's been said, give information, and that's where it ends. You don't tell people what to do. That's their choice to make. So that was hard for me sometimes, because there were times when I would listen and share some information and I heard people suggest that they were going to make a decision that I thought was the wrong one. But I had to keep my mouth quiet and not do anything, because it's not my place to do that. So that was an important lesson that I learned that I thought worth sharing.
Thank you.
Thank you, Barry. Yeah, it's definitely, it's definitely an interesting experience for, for myself, for our volunteers that support the people we're working with, to put us, take our fix-it hats off and to just support as we can and as needed. And, and I always say we just kind of, we meet the people, where they are. We're not there to change their theology, their religion, their faith, but we present them with information, and what they choose to do with it, is up to them. And then we listen, and with some people it's much easier, but with others, I start twitching sometimes. But it's definitely been an interesting. The past few months have been a very interesting journey.
And how do your volunteers get involved?
They can reach out to, let me drop my email, as they say, drop it in the chat, I think is the vernacular.
I would just, if I might, in the meantime, say, to clarify, I think it's always appropriate for someone to be able to make their own decision. The question is whether it's an informed decision, and a very appropriate decision for someone who understands ramifications would be not to do treatment. That's a personal decision. I don't think that we as advocates or mentors really have a right to object. I don't know what else to describe it, but I think what we can do is make sure the person truly understands the implications, to be able to make their own decision, and then to support them in making the decision, whether we personally agree or not. It's a very individual thing, and there is an appropriate decision not to do treatment, as long as it's informed. That's my personal opinion.
No, I agree. It's just, for instance, we have one woman we're working with who believes that her cancer is demons sent by God. So that is sometimes can be, a challenging situation, because a lot of the people we're working with, they also have some sort of mental health component, possibly, substance use disorder. So sometimes it's hard to know, how much of the information are they really absorbing? How much do their other, situations they're dealing with affect their impact? So it's a very, very interesting community we're working with. But yes, if anybody is interested in volunteering, whether it's to support someone with a diagnosis, and whether it's practical needs, connecting them to practical resources, whether it's just with some of the folks we work with. It's just a matter of either, a phone call once a week or, a walk at the park once a week, a cup of coffee. Or if anybody's interested in, if anybody likes to plan events or get involved in organizing of events, or if anyone is strongly, is passionate about advocacy and making an effort on, legislative level, all of those things, all those opportunities are there, and we can definitely make a difference in all of them.
Wonderful. Well, thank you both so much. Thank you everybody for coming today. I want to thank everybody for 2 hours on a Zoom call, which I know can sometimes not be the easiest of things. But I found today to be incredibly powerful and meaningful, and I hope has given some good guidance for people who need it. Again, we're going to share this video on our YouTube channel and send it out to the congregation. So if you know friends who weren't on the link, weren't on the call, but would benefit from this, please share away. And our thanks again to Austin and Joel for joining us this morning. And it was good to see good friends again.
Thank you very much.
Thanks.
Thank you. Have a great day.
All right,
Thank you,
you too.
everybody, for your.
All
for
right.